Okay, so let's get to look at an overview on the epidemiology of acute kidney injury, the AKI epidemiology. Epidemiology is basically all those percentages of how the disease condition has actually affected people worldwide. Okay, so for the epidemiology, talking about the incidents, if you are talking about the total of hospital admissions, acute kidney injury should be making up for about 1 to 5% of all the hospital admissions that we see. Then if you are talking about intensive care units, it should make up about 20 to 50% of the total intensive care units admissions, you always say. Then talking about cardiac surgery patients, we said that when there is acute kidney injury, there's usually accumulation of some electrolytes in the body. So this can actually lead to heart problems. So they make up about 10 to 20% of our cardiac problems, you see. For prevalence, it's about 30 to 40% of hospitalized patients has this problem. Then the ICU too. The mortality, if you are hearing about deaths in the hospital, the acute kidney injury is responsible for about 20 to 50% of all hospital deaths. Then talking about in a year, the whole mortality in a year, it should be responsible for about 50 to 70% of mortalities in a year. So risk factors is if your age is more than 65, if you have diabetes, if you have hypertension, if you have cardiovascular disease, there's sepsis, there's trauma, there's surgery. Okay, if you are taking some medications, they call them nephrotoxic drugs. These ones, they can be toxic to the kidney. Causes, you have things like sepsis, ischemia, nephrotoxins, obstructions, other things like glomerulonephritis and vasculitis. Okay. Outcomes for recovery, about 50 to 70% of people who have acute kidney disease or injury will still recover. But about 20 to 30 will actually lead to the chronic type. About 5 to 10 will lead to the end stage disease, and about 20 to 50 will die. Okay, so I think that's it for the epidemiology of acute kidney injury.